Good morning, everybody, and welcome to the Malnutrition Task Force Learning Event 2024, our seventh. And we've got a really good lineup of people this year. I'm very proud to introduce people that we haven't had before, and I think that you're going to really enjoy it. So, as you know, the MTF works in partnership with BAPN, and we together produce UK Malnutrition Awareness Week. So that takes us right from preventable malnutrition in the community over to disease related, which we need to bring together so that everybody understands that you can have one or the other or even both. And I'd like to start off by thanking all our supporters to make all this possible. So particularly Appetito, Age UK Board, the associate board members who give us so much time and so much support. And without this, we wouldn't be able to carry on. So thank you. So as usual, we're going to film this event and it can be viewed from the website at a later date. And we find this is the best way. Last year, we had several hundred views of the presentations. And it means that professionals particularly who don't seem to be able to get the time off to study are able to do this in their own time. So I think whatever we do on here today is going to be seen by quite a few people and it makes it really worthwhile. We've seen lots has changed this last 12 months, new government, the 10-year plan, other health and social care plans are afoot. Funds are short and many are worried about bills during the winter. At Age UK, we see that life is not getting any easier for older people, and the number of people over 85 is increasing. It's great that people are living longer, but we want older people to be living as well and being as independent for as long as they possibly can. And we also know that informal family carers are increasing, and they too are getting older and they're struggling with very little support. So it is that nutrition and hydration becomes even more important because it's the bedrock of us keeping healthy. It helps with our well-being. And we also know the risk of becoming dehydrated and malnourished is higher than ever before. So at this week, the UK MAW Week, it's a real chance to highlight our concerns, difficulties. And at this learning event, everybody's got the opportunity to share new ideas, research, and great practice that's happening across the UK. So this year, again, next slide, we're talking about ask, look, and listen, because actually we're all in this together and we're asking everyone, the general public, older people, carers, professionals, everyone to work together. And we're asking them to look and listen for signs of malnutrition and dehydration. And everything is easy to manage if it's spotted early. We know that. So everybody's responsibility is to look out for malnutrition. So we're asking professionals working together in multidisciplinary teams to spread the importance of good nutritional care and keep that high on the agenda, because together we can tackle this head on. So my next slide. So we've updated and refreshed quite a lot of our resources this year. We've got tools that can help start conversations. So if you're unsure about how to start that conversation with an older person about if they're eating enough, have a look at our guide. You can see it online or you can request some to be sent to you. We've refreshed the State of the Nation report, and it's a real overview, and it's quite shocking, of malnutrition in the UK today. It highlights the scale and the challenges of malnutrition, because sometimes I don't think we realise that it's out there, it's rife. So this report in the State of the Nation brings everything together, the stats, evidence from across social and healthcare, and it provides a unique snapshot of just what's happening to older people. The Eating Well in Later Life, we've refreshed that up. We've put some new guidance in it. You can request hard copies of those at the inquiries on the MTF website, and I can post those out to you. And that's for anybody. They're good in clinics, they're good at home, and they're good in voluntary sector organisations. So do drop me a line and I'm happy to send them out.